subscribers, thank you for tuning in. The topic that I would like to tackle today is GERD, the GastroEsophageal Reflux Disease with causes and treatment. The terms heartburn, acid reflux and GERD are very often considered the same, but they are not. They have different meanings. They just belong to the same family of gastric illnesses. Heartburn is only a symptom of both acid reflux and GERD. Most of the adult population experience heartburns at one moment or another. Just when the frequency increases to more than twice per week and the heartburns don't go away with very simple antacid medication, you definitely need to talk to your doctor about it. Your doctor might recommend changes to your diet and medication. Acid reflux is an illness which ranges in severity from mild till very serious. GERD is the chronic, more severe form of acid reflux. Uncontrolled or insufficiently controlled acid reflux can lead to esophageal cancer. The real cause is unknown. It might be stress-related or psychological. The problem is the valve relating the stomach with the esophagus, sometimes called low esophageal sphincter. This valve is controlled by the autonomic nervous system. Therefore, the question is, does it make any sense to treat an autonomic nervous system problem with an antacid medication? Even if the real cause of GERD is unknown, what we know are the risk factors or triggers. One common trigger is the hiatal hernia. Normally, the diaphragm helps to keep acid in the stomach. But if you have a hiatal hernia, acid can move up into the esophagus and cause symptoms of acid reflux disease. There are several conditions related to GERD, from anxiety to irritable bowel syndrome and asthma. More than 75% of people with asthma also experience GERD. Another trigger for GERD is being overweight. Even small gains in the body weight might trigger GERD, without the person having to be overweight. How does it happen? Well, the extra weight puts pressure on the abdomen, and the extra fat around the belly squeezes the stomach in such a way that fluid comes up into the esophagus. If the stomach is protected with a mucosa, the esophagus doesn't have the same protection, therefore the acidity is felt much more painful. Pregnancy is also related to GERD because of the same mechanism of pressuring on the abdomen, which increases the risk that you experience stomach acid leakage and GERD. Don't sleep on your stomach because the same will be happening. GERD can also be triggered by some medication like aspirin, ibuprofen, certain muscle relaxers, or blood pressure medication. A vitamin D deficiency can also trigger GERD. All the smooth muscles that we cannot control are regulated by vitamin D. It increases the calcium absorption. GERD may be triggered also by smoking and alcohol consumption, but it may also be triggered by other lifestyle behaviors like eating large meals or heavy meals, or snacking close to bedtime, lying down or going to sleep shortly after eating, or even bending over at the waist. You definitely need to know that there are certain foods and beverages which are forbidden with GERD. Citrus fruits lemons, limes, oranges and grapefruit, pineapple, tomato, chocolate, mint, garlic, onions, and even salt. Spicy or high-fat foods, fried foods, in general foods difficult to digest. The forbidden beverages are alcohol, carbonated drinks, soda, coffee and everything containing caffeine, and tea. My problem with this diet is that all the energizing foods and beverages are forbidden. Then how can I get my energy from? We can replace mint with chamomile or licorice root, and foods difficult to be digested with foods easy to be digested. Use probiotics to help digestion. Moving and doing exercises in the sun helps also the digestion by improving in the same time the vitamin D levels. Dietary triggers can vary from one person to another. Normally, you can see by yourself what's good and what's bad for your GERD. The most common medication prescribed for GERD is pantoprazole. Pantoprazole only decreases the acid production in the stomach. Some people have indeed too much acidity, but some others have too low acidity. According to my experience, pantoprazole only masks the symptoms, which make me unaware what are the bad foods for me. So I strongly do not recommend pantoprazole and all the other proton pump inhibitors, they also call PPIs, and also the H2 receptor blockers. Without this medication, your body will tell you what is good and what is bad. First, you need to know if you have too much acid or too low acid. Ask your doctor to test it. When already have low acid in the stomach, and this happens very often due to the age, diminishing even more the acid production will lead to undigested food. Pantoprazole creates dependency and has important secondary effects when taken on a long term. It blocks the acid production about 98 to 99% for about 16 to 18 hours of the day. But we need the acid to be able to digest the food and to absorb the vitamins and minerals that our body needs so much. Other medications that I do recommend are the foaming agents like Gaviscon. They coat your stomach to prevent GERD. Prokinetics like ranitidine can help strengthen the low esophageal sphincter, empty the stomach faster, and reduce acid reflux and GERD. For sure, the most commonly used are the antacids. Before finishing this first part devoted to GERD, I have to tell you the good news. there are solutions to GERD, and permanent solutions, which don't necessarily require a big budget, just a few minutes of your time every day, and they are guaranteed to work in a short enough time interval. You don't take any risk. You are either satisfied or reimbursed during the first 2 months. The only condition is to be a subscriber of my channel. You simply need to check the link in the description below. Please don't forget to subscribe, to like, and to share this video. It may help you and other people to find the answers that you are searching for. Bye bye YouTube. Bye bye subscribers. Bye.